The addiction medicine is not being taught in the American medical schools even today. Only 1% of the doctors are actively involved in providing care to these people with addiction or substance abuse disorders, or now we call opioid use disorders. We've created a lot of fancy names and definitions, but access to care has only increased 1 to 2%, while the death rate has gone up 10 to 15% annually for the past 20 years. In 1913, the Harrison Narcotic Act said that in a doctor's professional life, they cannot write another addictive medicine for an addictive condition. The problem is methadone is class 2 and Suboxone is class 3. They're all restricted drugs. So that line creates a big problem. All the regulations are created because of that line. In 1962, the Supreme Court said addiction is treatable. It's a chronic disease like any other disease, diabetes, hypertension, but the insurance companies and the policymakers have done nothing to ensure that people have access to care. Then there are coexisting mental health disorders, and the two conditions exist together. So if they're not properly treated simultaneously, the outcomes are not going to be good. We need to work together with the government to figure this out to resolve this crisis. The problem is that patients do not have access to doctors like me, so they're forced to go to the street, and the street drugs are getting more lethal with fentanyl in almost everything, and that's killing people. So we need to stop that process of young people dying while they're healthy at a very young age.